I want to welcome everybody to our webinar tonight. I am thrilled to have Dr. Arianna Staruch from Bastyr University join us tonight, and she's going to talk a bit about alternative therapies with me. Hello.
Hi, welcome everyone. I'm so glad to be here.
And I'm thrilled to have her come along to this webinar because while I can talk from a Western medicine perspective about some of these therapies, she has a lot more experience using them and prescribing them and knows a lot more about what she sees when she uses them. And I wanted to start by discussing with her, I think a lot of people are under the mistaken impression that our specialty, so I'm a medical doctor, MD. Dr. Staruch is a naturopathic doctor, an ND. And I know in a lot of states that's not a recognized type of physician. However, in the state of Washington, it is. They can be primary care physicians just like us. And I think a lot of people see what we do as opposing, whereas I think you and I both agree that it's very much complementary, that we have different expertise and together we can serve the whole woman. I just wanted to give you a chance to chat about that a bit.
Oh, yes, definitely. I think it's really important that we have a team care approach, and naturopathic physicians can offer a lot of lifestyle advice and really work side by side with our patients. Oftentimes we have the luxury of spending a little more time with them, and so we can really dive into support plans and treatment plans and really talk about why you need to do something so you understand what your body doing and why we think this is going to be helpful. And if women can understand why they need to do something, then they're more likely to do it. But I think that it's great to be able to work in partnerships with OB-GYNs and with other providers. These days, I don't think there's any one provider can be everything to a woman patient. I think that she really needs a team to help her navigate, especially through menopause, and into that third or half of our life that we're spending after menopause when things come up. I think it's, between our changing roles and having to take care of now maybe not only children, but now also my cat wants to get in the conversation. Also wanting to take care of parents, or being, in that situation where suddenly now you're taking care of a parent as well. I think it's just really important to have as many people you can talk to as possible so that you can make sure that you have all the options you need to have the best possible health.
Excellent. And the other thing I always, we're going to address this a little bit more later, but I like to start the conversation with a lot of natural remedies are helpful and wonderful for women, but just because something says natural does not mean it's harmless. Most of our pharmaceuticals, in fact, have a basis in natural remedies or are made from plants or other products like that. So having someone who you trust and who you know is educated in these remedies is always a good thing if you're going to walk down this pathway. I think you would probably agree with me there.
Yes, absolutely. Just because it's natural doesn't mean it's safe. And just because something works for your next door neighbor doesn't mean it's going to work for you or that it's the best thing for you. And these days, there's so much navigation of supplement companies and hype. And, it's really difficult to find an appropriate supplement and a good quality supplement, and to understand whether it's actually something that being good for you or not good for you. So I often would tell my patients to bring in their shopping bag with all their supplements in it. And we'd sit there and go through every single one and look at the ingredients and look at how much of each thing is in there and the form that it takes, whether, if it's a mineral, what kind of chelate it is, and determine which of the supplements that they're spending money on are the ones that they really need to be spending money on. And I think that that's unfortunately what happens is people hear about this and they hear about that, and they're spending all this money on supplements that they probably don't really need, especially if they would just eat a healthy diet and exercise more and work
But that's
on
hard.
their stress levels. Yeah, of course it's hard. That's why we walk with our patients on their journey. That's why I understand that making lifestyle changes is really hard. But,
Is.
you really need to think about supplements as supplementing,
Right.
not something that's going to be a quick fix. And the FDA says that herbs and supplements do not treat, mitigate, or cure any disease or medical condition. They can only support the structure and function of the body. And I really like to think about that because I wanted people to get away from thinking, I need to take this for that. I need to take, this drug for this condition or this supplement for this condition or this herb for this condition.
Mm-hmm.
You really want your supplements and herbs to be, how can it help my body to function optimally? Not, I'm going to take this, this herb for this condition. I'm going to take, hibiscus for hypertension. No, you want something that's going to optimize and support your overall cardiovascular system. And that's the real role that supplements should play.
And I think, it's a very similar approach to Western medicine, because I think a lot of us, when we talk with our patients, really talk about, well, what are the lifestyle modifications you can make to make yourself as healthy as you can be before we start a medication for something? And that's why I think working in conjunction with each other, we do people a lot more good. I'm going to start with some questions that we sort of pulled up. And like I said, if you're attending this webinar, feel free to throw some questions into the chat box if we're not addressing the questions that you have. So I wanted to start with menopausal symptoms. So a lot of women, as they hit the perimenopausal time, start to feel hot flashes and night sweats primarily, but other symptoms as well. Mm-hmm. And they may want to avoid starting with hormones as a remedy. And they want to talk about starting with herbal remedies. So what are some good herbs and or dietary modifications that women can make to try to manage the perimenopausal symptoms such as hot flashes or night sweats?
Yeah, I think, well, number one, I think it starts way before that. It starts when you're still perimenopausal. If you're noticing worsening PMS symptoms, kind of higher highs and lower lows, that's the time to start seeing if there are herbs and supplements that maybe will combine with diet and lifestyle that can help balance your hormones before you actually hit this space where you're actually getting hot flashes. So menopause is a journey. So it's from perimenopause to menopause to postmenopause. And so oftentimes I'll start early with women that are still cycling, but maybe their cycles are a little irregular or they're just having more PMS symptoms with something like chaste tree berry or Vitex. And sometimes that alone is fine and it'll work for a while. And then as the woman gets more into the transition and maybe the ovaries are starting to not make as much estrogen, and even though the brain is giving her FSH, the ovaries are like, nope, not going there, not doing it. So it's a time when you may start to need to add additional supplements and herbs. So things like black cohosh and any of the herbs that have the plant-based compounds that have the ability to bind to estrogen receptors but are not really estrogen. So they're known as phytoestrogens. They're not really estrogen. They're plant-based products that have the ability to bind to the receptors, but in a very weak way. So they can help balance, bring down the highs and bring up the lows. And so lots of times those are helpful. In addition, then also dealing with supporting the adrenal glands. Sorry, the cat's meowing. The adrenal glands are really important as a source of some estrogen. Now, when you're cycling and when your ovaries are doing their job, the little bit the adrenal glands make or the fat cells make doesn't really make much difference because most of it is coming from the ovaries. But once the ovaries start to retire and stop making as much estrogen, then those other sources become much more important. And so one of those sources is the adrenal glands. So making sure that you're supporting the adrenal glands both by lifestyle things like getting good sleep and exercising regularly to reduce stress and eating well, but then also some specific herbal support for the adrenal glands as well. But if that is still not doing it, and if a woman has gotten to the place where she's having hot flashes all day long and she's having night sweats or she's soaking the sheets and she's not getting good sleep, then I think it's time to have the conversation about hormone replacement.
And we got a question while you were talking from one of our attendees, and she's asking, when a woman is already in postmenopausal stage, is it beneficial to seek any sort of therapy? From my perspective, I see women in the postmenopausal stage all the time because I do primarily vaginal and sexual health.
Mm-hmm.
And a lot of the sexual symptoms, a lot of the vaginal symptoms really don't show up until 2 or 4 years into the menopause, because the tissues just take that take that long to lose all their estrogen and really start to be symptomatic. But I tell women, I treat the symptoms you're having. If you are postmenopause and you're doing great and diet and exercise are keeping you healthy and you feel well and you're not really suffering from symptoms, then there's nothing for us to treat because you're healthy and normal. And menopause is not an abnormal state, it's a normal state. But if you are in your postmenopausal time having a problem, then definitely come and see us. There are things that we can start even then, including diet, exercise, all sorts of things. And sometimes even hormones in that postmenopausal state can be helpful.
No, I totally
the other
agree.
thing and the other thing to keep in mind is that when a woman is postmenopausal, the things that we need to be thinking about are, what are we going to do to keep this woman healthy for the next 30 years of her life?
Yes.
Because postmenopause is not an end. Women live long and healthy lives after menopause. So that's when I start to talk to women about bone health and cardiovascular health. And, thinking about diabetes and, how to, and blood pressure and things that day to day you just need to be aware of and make sure that you stay healthy.
Yes, absolutely. I agree on that 100%. And so I try and have women that are perimenopausal and just getting into the menopause state to say, now's the time to make the changes, because you are going to live, a third of your life after menopause. And so, number one, we just can't get away with what we used to get away with anymore. We can't pull the all-nighters and not get a good night's sleep and eat a lot of McDonald's. Now's the time to make the changes, because we're looking towards that postmenopausal time to make sure that we're keeping the heart healthy and the bones healthy. We know that women in particular after menopause will have an increased risk for heart disease, increased risk for osteoporosis. And so we know that's coming. And so the idea is to reduce the impact of that as much as possible so that you do live a long, healthy, happy, productive life after menopause.
I had one more question for you on this sort of the symptomatic subject, which is what are your thoughts on acupuncture as a therapy for menopausal symptoms?
Acupuncture works pretty well for some women. Again, it's a whole approach. It's a holistic approach to health. And so again, the acupuncture is not, although it can help symptomatically, it's also a whole system of medicine that helps support the whole person. And so some women may find that acupuncture is really helpful with relaxation and with decreasing hot flashes, along with a lot of acupuncturists also do East Asian herb combinations, and will look at providing specific herbal formulas to support the overall health.
From my perspective, I often think of acupuncture as something that, in a sense, supports the adrenal glands. I mean, when I think about the adrenal glands, I think about stress and the stress hormones. And if you're very stressed all the time, you're really overworking those glands. And I find that acupuncture often can be a very meditative and relaxation supporting therapy, and that can be very helpful for women.
Yeah. So I suggest women try it, and if it works for them, great. If it's not something, because there's some people actually don't like the feeling of the cheesings and when the needles get put in, and other people fall asleep. When I've had acupuncture, I never fall asleep on the table, but I go particularly when I've had an injury, because I know that it works really well for helping me heal. from an injury. But it's not as much relaxation for me. I think I like massage better than that. So I say try what works for you. I mean, it's not, find a really good practitioner, someone you can trust, and try to and see if it works for you. And if it works, great.
And I think that goes back to your original point that the thing that's good for your neighbor may not be good for you. You know,
Yes.
everyone needs to think about what works best for them. And that sort of leads me into another topic that I wanted to talk about with you, because I think we all see people who come into us who've been placed on something called bioidentical or compounded hormones by practitioners who say that they've tested their particular hormones and made this combination just for them. And I think that frustrates me as a provider, because I find that these are no more safe or natural than the hormones that I prescribe, which are bioidentical, which is estradiol and micronized progesterone, which are pharmaceutical.
Mm-hmm.
In fact, often they're taking my pharmaceutical and grinding them up and compounding them and then having them be spread on the skin. I find them less reliable in terms of absorption. And I think a lot of times these things are being sold as a safer alternative, and that just drives me crazy, because if you're taking a hormone, you're taking a hormone, and there's
Yes.
no safety in that.
Yes, I agree. It frustrates me too, because just estrogen is estrogen, and there may be different forms. There's estradiol, estrone, and estriol, but it's all estrogen. And if you're looking to supplement estrogen because you need to supplement estrogen, the active form is estradiol, and we know that if you do an estradiol pharmaceutical, you know what you're getting, and you know the absorption. And if you need to do something transdermal, well, the transdermal patches have had studies to show that they're being absorbed, and they're being absorbed at a constant rate. The worst thing you can do when you're trying to manage hot flashes is to have irregular dosing of estrogen. It just makes everything
Very
worse.
true.
And
Absolutely.
so, having any kind of topical that is not a patch that's been tested for its delivery is really just going to make things worse instead of better.
Yeah. And I think the biggest issue for me is often with the progesterone, because when you compound that and put it into a cream, it's really a very large molecule that does not absorb well through the surface skin. And progesterone is key in hormone replacement because it protects the uterus and prevents you from getting cancer. And so playing around with a hormone that's there to prevent cancer is not something you want to be doing, especially since we also know that progesterone is the one hormone that could have some risk for breast cancer. So having uneven absorption, which might even be higher than what you want, is not where you want to go. You want to know exactly what you're taking of that hormone.
Yeah. So especially if someone's on estrogen, they need to have the appropriate progesterone. If they're not on hormone replacement therapy and they're just wanting to use a progesterone cream for hot flashes or for sleep, it's not the same thing as if someone that's taking HRT. At that point, you're not as concerned about the absorption being consistent. You're not you're not getting that much progesterone. For symptomatic relief of hot flashes, the topical progesterones are probably fine. It's just they're not okay if you're trying to use it to balance estrogen.
Right. And, I always tell my patients, if they want to use the topical progesterones for things like hot flashes or sleep, to be aware that it is still a progesterone and has whatever attendant risks comes with that.
Yeah.
I think I'd love to move on to sleep. And the reason I want to move into sleep is because I think it's a huge issue for women in the perimenopausal transition, but also in menopause. I think we all deal with a lot of folks who are having trouble with insomnia or night sweats. And, I'd love to talk with you a bit about how you approach sleep with your patients, because I think we probably approach it very similarly in that there's no magic pill for sleep, unfortunately.
Right. Everyone wants one, but there's nothing. And the problem with some of the pills for sleep, even something like, the Advil PM, is that it keeps you from getting the right kind of sleep. And so it's important to really, again, go back to the lifestyle issue of good sleep hygiene. understanding, first
Yes.
of all, why are you not sleeping? And there's a lot of reasons why women may not be sleeping. It could be hot flashes, it could be heartburn, it could be anxiety, it could be, sleep apnea. There's a lot of different reasons. So the very first question is to say, well, why aren't you sleeping? And see if we can figure that out. Cognitive behavioral therapy is great for that because it has those two pieces. It has the learning and knowing why you're not sleeping, and then the behaviors to help you to get better sleep. And
Yeah, and that's actually one of the few things that has really good data for helping women sleep is cognitive
yeah,
behavioral therapy.
yeah, yeah. And then on top
Yeah.
of that, it also helps with stress, which helps with everything else. So,
Yes,
um,
that's true.
yeah. So I do like
Are there
CBT.
some are there some herbal remedies that women can use safely to help with sleep after they've approached the sleep hygiene and the cognitive behavioral therapy?
I think on occasion, so if kind of like, okay, you have a big meeting tomorrow or you have something you have to do tomorrow, you need to get a good night's sleep and you're not sleeping well. I mean, you can try doing some herbal teas, things like chamomile, valerian, passion flower, lemon balm. Actually, with kids, catnip is actually a really nice tea to,
Oh,
to support restful sleep. Um, so there's a number of nervine herbs that are very gentle, and you can try doing a nice cup of tea and use the action of making the cup of tea also part of your ritual to kind of slow down and unplug and get ready for sleep and have a nice cup of herbal tea. Um, I think that that's kind of the best way to approach it. But again, if you're looking for something that you can just take every night to make sure you sleep, herbs are not the right thing either.
no.
So I think you really need to look deeper.
Yeah. So while we were chatting about that, we did get a question about vaginal dryness post-menopause, and this is a great one for us to address because I think we both probably deal with this a lot. My practice is primarily in vaginal health. And when I approach vaginal dryness and menopause, I talk to women about where is the dryness impacting their life? Is it a day-to-day thing? Are you feeling dry just going about your daily life? Or, is the toilet paper hurting? It's so dry down there. And for and then I also talk about sexual function. So, are you also having dryness that is preventing you from having comfortable sex? Because we treat those slightly differently. I usually start with women with the vaginal moisturizers for the day-to-day dryness. So there are, Genneve makes a lovely vaginal moisturizer. There's Replens you can buy over the counter. A lot of women find that coconut oil is a great vaginal moisturizer used daily. I just warn that one can stain your underpants, so be aware. I also always start by talking about good vulvar health and care. And that's because I
Mhm.
think we are marketed a lot of products as women that are supposed to make
Mhm.
us more fresh, more well scented, make us clean down there. When in fact, the vagina is a self cleaning oven, as I like to say. It takes perfect care of itself most of the time. And we should never be putting things up there without consulting with a physician because most of the time you don't need to put a whole lot up there. Now, in menopause, sometimes these moisturizers will be great or lubricants for intercourse, but a lot of women need more than that. And that's when I really tend to move to locally applied hormone. And that's important because I think even if you're on a systemic hormone for hot flashes, often it doesn't work as well at the vagina, and you have to think
Yeah.
about locally applying them. And there are lots of, very low dose, medium dose, and then higher dose remedies that we can use down there. Is there anything that you
Mhm.
sometimes will try other
Yeah, I
than
definitely
sort of
agree.
hormone replacement?
Well, the same thing, women will come to me and they say, lots of times they'll come to an naturopath because they say, well, I don't want to do hormones. And they just, mainly because they're scared, whether it was
Right.
from the Women's Health Initiative study. But this is one area where with vaginal atrophy, I'm like, why live like that? You don't have to worry about, you know, using the estrogen. It's not going to be for the rest of your life. You can use it locally. You can, use it more frequently in the beginning and then just less and less as you need it less, as maintenance. So it's not the same thing as going on oral HRT
Right.
to have the local vaginal estrogen. And so I really help women to understand that they don't need to suffer needlessly.
No.
And then I'm really excited about the other work you're doing, because I think that's a great non-drug way of
Right.
supporting and actually addressing the cause, which is actually rebuilding the tissue. So
Right.
as a naturopath, I'm always about addressing the cause and not
Right.
just treating the symptoms.
And what we're talking about there is I also in my practice use Monalisa touch laser, and I use it primarily in women who either have not succeeded with vaginal hormones or who have a reason they cannot take hormones. So I have a practice that's got a large proportion of breast cancer survivors in it. And so while there is good evidence that some of the ultra low dose hormone preparations are safe even in breast cancer survivors, some women just don't even want to take that risk or have failed those ultra low dose preparations. So we can use the Monalisa touch as well. And I just want to put a quick warning in here right now about the laser and other energy based therapies for vaginal tissue. I think a lot of women heard about an FDA warning coming out. What that was a letter to the companies that make all the devices just saying, please do not market for things you are not approved to do. They
Right.
didn't say that, and they are worried that some of these therapies could cause harm. The reason being there are eight or nine therapies on the market. The only one with data that's long-term data, and most of it is just outcomes data, but there is at least data, is Monalisa Touch, and there are about 10 years of data for that. There's also about 10 years of safety for that. There are a lot of other devices being marketed with no data, and they are marketed primarily for premenopausal women for vaginal rejuvenation and sexual function, but people will use them in postmenopausal women. But just be aware that while none of these are FDA approved for postmenopausal atrophy, Monalisa Touch is the only one that actually has some evidence.
Mm-hmm.
And I agree with you. I mean, I think women should not suffer needlessly with vaginal dryness or painful intercourse. And it's especially good to know that there are some ultra low dose hormones where you can take just the estrogen, take it at such a low dose, it
Mm-hmm.
doesn't absorb systemically and can really treat those symptoms. So please, please come talk to us about that if that's an issue for you.
Yeah. And the other piece of that women often don't realize is that if they're having frequent bladder infections, it really could be because of vaginal atrophy. And the way to stop getting the bladder infection is to address the vaginal atrophy.
Yeah, and women who struggle with incontinence, that gets
Mm-hmm.
worse in menopause. I find that the laser does an exceptionally good job for that, but
Mm-hmm.
estrogen can help with that as well. And
Mm-hmm.
you don't
Yes.
have to live with incontinence just because you had a couple of kids.
Correct. Yeah. And there's also some
I'd,
pelvic floor physical therapy
oh
that's
yes,
helpful as well, with biofeedback. That's helpful, I think, especially for the stress incontinence. I think and there's
yes,
some pelvic floor trigger
absolutely.
point work, which
And
is
with
really
pelvic pain.
interesting.
Yeah,
Yeah. So
yes.
the pelvic floor trigger point work is actually something that I did learn, and I found it to
Hmm.
be very helpful for a lot of different, either even musculoskeletal conditions, um,
Oh yeah,
leg pain, back pain, because the muscles come through the pelvic bowl, and so being
yeah,
able
they do.
to do some trigger point therapy there is can be really helpful.
Well, I think we often forget to think about our pelvic floor when we think about our core. And it's an integral part
Yeah.
of our core. So if
Mm-hmm.
our back or our stomach muscles are off kilter, and we sort of understand that intrinsically, but the same thing can happen with our pelvic floor. And having them all working simultaneously and well together makes a huge difference.
Yep.
That somewhat leads us into libido, which is always a challenge. I know, I talk about it a lot with my patients.
Mm-hmm.
And, I have a lot of more cognitive behavioral things, interventions and things like that. But are there any herbs that sort of help support a woman's libido through the menopausal transition?
Unfortunately, there's nothing really good out there that has had any research.
Yeah.
There's lots of stories, Maca and um, Damiana and all this stuff, but there's really no good research. Um, showing that's really helpful. You know, I think there's a hormonal component, and then there's the mental emotional component. And so, especially for women, a lot of libido is in our head. And
Yeah.
so it's really about, you know, understanding your relationships are changing, your roles are changing, your partner may be changing. And
Your body
so
is changing.
your body is changing. So it's, you know, there's not a magic pill, you know, there's not a little
Right.
blue pill for libido in women, because it's not about blood vessels, it's about our
Right.
brains. And
And
so I
that's
think it's important.
that's a really important point. I mean, there is, you know, and I talk about this a lot. There is a single pill. Now, there are 29 pills for men in their sexual function. We have one. That one pill is not approved in postmenopausal women.
Yeah.
And I think it's not a great medication. I don't personally prescribe it because I don't think it does a whole lot of good and has a lot of side
Yeah.
effects and interactions that can
Right.
be quite troublesome. I am excited that we're looking. However, I think we're never going to find the one cure all because everyone's sexual function is so individualized and complex.
Yeah.
That being said, I'm a huge proponent of women taking care of themselves
Mm-hmm.
sexually, thinking about, how to cause their own arousal, not depending on somebody else for it.
Mm-hmm.
So I often recommend sex toy websites, which Shannon can give out some of those, making sure you have adequate lubrication, a couple of good dirty books that just are your go-tos. Those help you to get in the mood, but fundamentally understanding where the relationship plays a role in this is key, because if you don't fix the underlying interpersonal relationship, we don't really get anywhere.
Yeah. Yeah. But I think it is important for women to be able to understand how their body functions, and to, you know, be willing to explore that and make sure that they're understanding where their, you know, their sexiness lies and how it's shifting.
Yeah.
And, you know, maybe something that worked for them when they were younger is not going to be the same thing that works for them when they're older to get things going. So I think
And the
that's really
way our
important.
nerves work changes
Mhm.
over time, and the way
Mhm.
our sensation down there works is different over time, and just understanding our own bodies is key.
Yeah.
Let's talk a tiny little bit about weight gain in menopause. I think you probably spend a lot of time talking with women about diet and exercise and lifestyle and how that needs to change as we age. I think I always talk to women about the fact that the change in your weight and the change in your body distribution is normal and natural, and we are supposed
Yes.
to look different when
Yes.
we are 60 than we did when we were 20, because our bodies are made for different things at those different ages. And I like thinking of some of the weight gain as protective.
Yes.
We know that women who stay very, very thin through menopause have a lot more trouble with bone health and things like that.
Mm-hmm.
And, the changes our bodies are making are to protect us. We just have to understand them and understand how we need to interact with our body differently.
Yeah. Well, I think true, because again, where are the places we're getting estrogen from? Now there's
Right,
our fat cells, there's
right.
aromatization in our fat cells. And so I think it is a protective mechanism for menopausal women to put on some weight, um, to help to maintain that level of estrogen that's necessary for bone health.
Right.
So,
Unfortunately, society doesn't agree with us. It
right,
thinks we should all be bone thin for our entire
right.
lives. But in fact, that's probably not the safest way to be for women.
Yeah. I like to look back at the ancient goddess statues where they had
Right.
the big breasts and the big hips, and there was actually you could pray to one goddess for the boon of having big hips and big thighs. I mean,
Right.
that's, you know, because that meant you were going to be able to have healthy babies and feed them lots of milk, and so having big thighs was really an advantage. And so I miss those days.
We did get a question in about bone health and osteoporosis, which I think is a very important thing for women to think about in menopause. And, so much of bone health is determined early by the bone we build when we're
Mhm.
young. But maintaining our bone health as we transition through perimenopause and into menopause is something we can work on ourselves, as well as make sure we're being checked on and see if we need additional therapy. So do you want to talk a little bit about like the lifestyle things that we do to maintain our good bone health in menopause?
Sure. Well, the main things definitely are calcium and vitamin D, making sure that you're not doing anything to wash out those minerals, like soda, a lot of soda pop
Yeah.
with phosphates, and you're maintaining healthy levels of vitamin D. And the best calcium is the calcium you can eat, not the calcium you take. So
Right.
dark green leafy vegetables, lots of different kinds of dark green leafy vegetables, some low-fat dairy, but dairy is not the only source of vitamin D and calcium. There's lots of other sources that would also help provide those phytonutrients that you need to be healthy long-term for the other parts of your body.
Yeah.
So I think it's
Soy is a good source of calcium, isn't it?
soy is, and a lot of the nut beverages, they're not allowed to call them nut milk. They're not allowed to say almond milk anymore. The dairy industry said you
Yes.
can't do that. But
Right.
a lot of
Nut
those
juice.
will, nut juice will have
That doesn't
calcium
sound
in
good
it, or
either.
they'll have some added calcium.
Mhm.
So I think that, when it's 1,200 milligrams or 1,500 milligrams of calcium, that's every source of calcium. It doesn't mean you got to take a pill that provides that much every day. I think it's everywhere that it's coming from your dark green leafy vegetables,
Mhm.
from your low fat yogurt, from all those areas that have calcium, and then exercise, both for stress reduction but also for maintaining the bone you have.
Mhm.
Making sure that you're maintaining your muscle mass, which is also really critical for women as they get older. The loss of muscle can really impact overall health. So you're exercising to maintain good, strong muscles, which will also provide continued stress for your bones, to keep your bones from maybe losing as much as fast.
And the key here is weight-bearing exercise, and that doesn't have to be
Mm-hmm.
marathon running. We're talking about
No,
walking.
walking, just your body against gravity is the best thing you can do. And it's just, 10 minutes at a time, 30 minutes a day, do walking meetings, do a walk around the neighborhood,
Right.
get a dog.
They'll definitely keep you walking.
Yep.
And I do talk with my patients about vitamin D. And now,
Mhm.
granted, I live in Seattle, as do you.
Mhm.
Not a whole lot of sunshine in the wintertime. And all of us have learned over the years to be very good about our sunblock. And most of
Right.
the vitamin D we get is not eaten, it's actually elaborated in our skin.
Yeah. And so that is true, that even just a SPF 15 will block most of the production in the skin. So it is important to sometimes make sure that you're getting the proper amounts of vitamin D. We need to have Becca restart her screen because she froze on us. um,
Their
but one
osteo.
thing, there
Oh,
you
go ahead.
go. Go ahead.
I was going to say, for women who have DEXA scans that show that they actually have osteoporosis, or women who've had fractures due to osteoporosis, then we're taking it to a different level. And then we need to
Yes.
be treating specifically bone strength, because
Right.
osteoporotic fractures can be debilitating in later life, and we
Yes.
don't want women to
Yes.
live with that. So that's when I will either myself start something called a bisphosphonate, which is a medication that specifically strengthens bone or prevents resorption of bone, or I'll refer them to someone who has a lot more experience with that.
Mm-hmm. Yes, and especially, the vertebral fractures can cause a lot of
Mm-hmm.
back pain and keep you from walking, which is, of course, then just keeps you from exercising, keeps you
Right.
from keep staying healthy. And then, of course, hip fractures are just devastating. It can remove your independence, and
Mm-hmm.
so we really need to be watching out for those and to prevent those.
Right.
So other things to do is also when you have osteoporosis is to prevent falls. So things
Right.
like
Good point.
Tai Chi is really good for helping maintain your balance. I love that everybody's into Nordic walking sticks these days because it provides some stability when you're walking, and you don't have to feel like, oh, I'm getting old, I have to use a cane. No, I'm out there with my trekking poles. And so I often recommend to a lot of my older women that are like averse to using a cane, I said, well, get yourself some trekking poles. And it also
Exactly.
increases the amount of muscles you're using, and it helps provide stability. But anything you can do, removing all of like the loose rugs around the floor, being careful
Right.
going up and down stairs. I mean, you just need to make sure that you don't put yourself in the situation where you're going to fall and break something as much as you can.
And then one other thing I wanted us to chat about, because I find it can be incredibly frustrating for me to do with my patients, and I'm sure you do the same thing, is how do you navigate with patients all the amazing and confusing amount of online information and people selling them stuff, and there's just so much out there. And, I have a degree in epidemiology and biostatistics, so I can look at the data behind things, but the average
Mm-hmm.
person going through the internet just doesn't have access to all that information, nor do they have the skills necessarily to evaluate it. So how do you help people to, what do you say is a good like starter point? How do you navigate this stuff?
Well, the first question is, is it science or is it marketing? And
Right.
that's really, when I look at a lot of these supplements, like for instance, herbs and minerals are very bulky. They're big. And so you have to put them into a capsule. The capsules are going to be big, and you're going to have to take like 6 of them a day to get enough of anything. So if you have a supplement that says take 1 a day and it's a little tiny capsule and it's supposed to have herbs in it, likely there's not enough herbs in there to really be doing anything. It's more marketing than it is, actual help. Again, 10 milligrams of an herb in a formula is probably not going to do much. And so that's one thing I start to teach my patients. I have them, again, bring in their bottles, and we look at the bottle and we look at the label, and we talk about all the things to look for good manufacturing product practices, the GMP logo, to know that it's a high quality. Find out if your provider has a brand that they think that they've studied and know that it's a high quality. So a lot of the professional grade products that we use as naturopaths, the reason we say, don't get your fish oils from Costco is because we want to make sure that you're getting high quality supplements that are going to be consistent time after time after time. And so the professional products that are sold to us, we pay attention, and if suddenly something stops working, we call the company up and we say what's going on, or we stop using them. So the companies make sure that they have consistency, they have high quality, and that their formulas make sense. So
Right.
sometimes if you want to avoid a lot of trying to figure that out, start off by starting with a really reputable company.
Yeah, and I when I talk to my patients, I say, the first thing is this person selling me something? Now,
Right.
that can be hard to determine because, as physicians, we do take money for our services and we do need to make a living. But, sort of understand how they're marketing to you. Like, is only their product the only one that's ever going to work and everybody else's is bad? Because that's
Right.
somewhat of a red flag for me.
Right.
And, I struggle to recommend herbals. I think you have more knowledge of the companies, but I struggle because at least, I have the benefit of the FDA looking at my
Mm-hmm.
pharmaceuticals and
Right.
testing them and making sure they are what they say they are. The FDA is not perfect, but at least I have that assurance that the stuff I order out of a
Mm-hmm.
pharmacy is going to have that level of security. Whereas, you have to sort of know your herbal ceuticals
Mm-hmm.
or nutraceuticals because they don't have the FDA looking over their shoulder.
Right. So for instance, at the Bastyr Center for Natural Health, our dispensary there, before they let any product into the dispensary, they put them through a whole quality control thing where they have to
Right.
provide independent assays of their products and from independent laboratories, and to show that what they say is on the label is actually in the bottle.
Right.
It's tough. It's really tough. But I am leery of multi-level marketing.
Ugh,
I'm
so
leery of
many of those.
anything that says proprietary blend of. I'm like, well, I can't tell. I can't tell what's in there. I
Right.
can't tell how many milligrams. If it doesn't say on the bottle
Right.
exactly what's in it, then I would not buy it, because how
Yeah.
can you know what's even in there? If it says a blend of,
Hmm.
and it says 5 different herbs, doesn't tell you how much, doesn't tell you the Latin names. My cats in here again. Then it's probably, they're not caring enough to give you the information you need to be able to make a good determination.
Yeah. And, I always tell my patients, look for someone who has expertise in what they're doing. So if
Mhm.
you're looking at hormone replacement or, laser therapy or something like that, look for a physician. If you're looking for herbals, look for a naturopath or someone like that, not someone who's just put themselves up, not a celebrity. Don't listen to celebrities for your healthcare. They really do
Right,
not know what they're talking about.
right.
Um, and the other red flag for me is someone who says only they can fix you. So what I
No.
tell all
Yeah.
of my patients is that there are a lot of wonderful OBGYNs in the region who have knowledge that is like mine and different from mine. And that if you are not feeling comfortable with what I'm recommending, you should absolutely get a second opinion, because they may have something else to offer that I am not thinking of. And it does not threaten me in any way if someone
Right.
needs to get a second opinion and think about it. Nor
Yeah.
do I give anyone the hard sell, because really I want you to feel comfortable with the treatment you're getting.
Right. It's all about giving the patient the information they need to make the choice for themselves. And so if
Exactly.
you then give them the information and they choose to go somewhere else, then you can't fault them for that.
No. In fact,
It's all
I have sought second opinions in my day too. Not, every MD brings not only their knowledge base to how they counsel you, but also their personal experience. And sometimes there's just somebody else who
right,
fits you better.
right, right. I think that's really critical.
Well, I think that's a great place for us to stop. We've covered a ton of territory, I think, tonight. Are there any last minute questions from the folks who have joined us online before we sign off? I think this was a long but very interesting one for us tonight, and I think a lot of people are going to be watching this one. Well, since I'm not seeing any other questions come up, I want to thank Dr. Arianna Staruch for joining me today. And as I
Oh, it
said,
was my pleasure.
she's a dean
Absolutely my
at
pleasure.
Bastyr University for naturopathic medicine, and just a font of knowledge of things I just don't know anything about. But I think we both approach patient care in a very similar way, which is,
Right.
treating the whole patient and finding the best therapy for them.
Yeah, the woman comes first.
Exactly.
Yes.
Well, thank you everyone for being here
Thank
tonight,
you.
and hopefully you'll join us for a future webinar. Bye-bye.
Bye-bye. Bye, everyone.